Good morning, everyone, and welcome to today's event on the development of the Social Prescribing Framework for Wales. I'm Kerry Phipps, National Allied Health Professions or AHP Lead for Primary and Community Care, allied to the Strategic Programme for Primary Care and your chair for today. So we understand that there's a relationship between what people do and how it makes them feel, with social prescribing recognised as beneficial to improving the health and well-being of individuals and societies. In Wales, social prescribing has been described as connecting citizens to community support to better manage their health and well-being. And unsurprisingly, it's being viewed as a key response to the increase in loneliness and adverse impacts on our health and well-being of the COVID pandemic. Therefore, the Welsh Government has committed to making social prescribing a priority in its programme for government, and its commitment to developing a national framework is to make social prescribing an integrated part of the health and social care system, ensuring meaningful outcomes for our population and connecting services and community groups for the benefit of all. Ensuring maximum realisation of social prescribing benefits, increased consistency in the effectiveness of social prescribing, and also help us to understand why people don't take up referrals so that we can make social prescribing work for everyone, particularly those with complex needs. Exploring ways of working in synergy across all settings and all partners, and with those in specific social prescribing roles, with our occupational therapists, our mental health practitioners, and the wider workforce. Ensuring prevention and wellbeing is embedded across all areas of health and care support, and we're developing resources and training for a variety of people involved in social prescribing. So this is one of a number of social prescribing engagement activities with the intended audience for today, the primary and community care workforce, to support thinking about how you can contribute to the developing framework in Wales, as well as support the framework delivery in your locality area. Recognising there's a huge amount of existing social prescribing activity across Wales, the framework will draw together the learning from this, build on existing good practice, and provide a uniformity of what good looks like, which can be localised in delivery. In terms of today's Teams etiquette, we are recording, and can I ask you to mute your audio and turn cameras off to reduce interruptions? I'm very pleased to inform that this event will be available for catch-up purposes for 30 days post-event. Thereafter, today's event can be viewed on the PC1 website. At 11 o'clock, we will be facilitating a Q&A session. And as we progress through the morning, if you have any questions in preparation for this, can you please use the Slido function that is present on the web page, located underneath the live stream. You may need to scroll down a little to see this. We're also aware that some health boards have IT restrictions in place. If you have any difficulties accessing Slido and wish to raise a question, you can email your question to the Strategic Programme for Primary Care's email address. So that's sppc@wales.nhs.uk. We also have some questions for you, as we're keen to collect your thoughts, and we'll be using engagement polls during the Developing Framework presentation and at the end of the event. So the polls section sits alongside the question function below the video. Just toggle between the two tabs to access the function you want to use. Okay. So on that note, I'm very pleased to introduce Lynn Neagle, Deputy Minister for Mental Health and Wellbeing, and Albert Heaney, Chief Social Care Officer for Wales.
Welcome to you all here today. It's fantastic that you're coming together to share information about social prescribing, to hear about our work developing an All Wales framework, and to discuss how best we engage with you to ensure the crucial role you play is reflected within that framework. Now more than ever, we have to work together to aid Wales in its recovery from COVID-19. Social prescribing and the role you have as part of that is of great importance. The pandemic has been a difficult time for many of us. COVID-19 has shone a harsh light on some of the health and wider inequalities that persist in our society. The evidence is clear that COVID-19 has had an unequal impact on many in our society who already face discrimination and disadvantage. The impact of the pandemic has been particularly detrimental to older people, individuals with underlying conditions such as obesity, mental health, and on people from Black, Asian and minority ethnic communities. As we plot a course to recovery and reconstruction, my ministerial colleagues and I are only too aware of the challenges that we face to emerge from the pandemic stronger and better prepared to help the people of Wales. Social prescribing will play an important role in that recovery. It can help shift the emphasis from treating illness to promoting better well-being, to support people to take greater control of their own health and to support the broader preventative agenda. That's why I am pleased social prescribing is a key priority for this Welsh Government. The introduction of an all-Wales framework to roll out social prescribing features as a key commitment in our programme for government, and I am delighted to be the Minister responsible for putting this commitment into practice. Our work to develop the framework is ongoing, and I have been clear that this framework is to support the excellent work already underway across Wales, rather than to build a new service from scratch. I wanted to support people just like you to carry on delivering your vital work in a supported and sustainable way. Our aim is to understand what the framework can do to add value to social prescribing in Wales, and events such as today's will help us identify what work Welsh Government and our partners might be able to do to support Once for Wales activity. We want to develop an all-Wales framework for social prescribing that embeds access to prevention services and well-being activities into our clinical pathways. It's also important for us to be clear as to what the framework will not be. It will not be something that creates an all-Wales social prescribing service that dictates how these services are run. There are fantastic examples across Wales of existing social prescribing projects that deliver for their local communities. One example is the Cardiff and Vale Seamless Social Prescribing Project. This project is a progressive approach to improving population health and well-being, reducing the burden on statutory services and helping to combat the health consequences of loneliness, isolation and disconnection. The project aims to achieve this through a joined-up system of communities, third and independent sector partners, primary and community services. So far, the project have opened talking cafes and rolled out a new social prescribing platform across 11 GP practices in the Cardiff South West cluster. The Wellbeing Discharge Hub has a full-time occupational therapist working as part of the team, which allows for a more flexible and agile response. An advanced care planning training has been instigated in local care homes. As our work to develop the framework evolves, it is incredibly important that you have a voice in how it can support you. The views of people referring into and delivering these services, your views, are so important in making sure we get this right. I am very grateful for the key role you all play regarding the health and well-being of the people of Wales and want to thank you in advance for the invaluable contribution you will make today. Thank you once again, and I hope you enjoyed today's event, which provides a valuable opportunity for us to come together to share learning and work together to support the benefits social prescribing will bring. Diolch yn fawr I chi gyd.
It is well known that many people presenting with health issues do so as a consequence of an unmet need. Individuals may not need medical intervention. What they may need is support to help them stay healthy, well and active, and to help them stay connected to their community. Evidence tells us that loneliness and isolation is one of the biggest contributing factors to people's poor health. The social prescribing agenda continues to gather pace, with most parts of Wales now having access to some form of community coordination. Much of this activity has been successfully kick-started by the Integration Fund and the Transformation Fund. We will now be seeking to work through the regional partnership boards and the new Regional Integration Fund to ensure these new ways of working become fully embedded in our health and social care system. And one particularly good example of community coordination is the Mourne Community Link social prescribing service. In Anglesey, the GP Cluster Group in April 2019 entered into a pooled budget arrangement alongside the council and the local health board to test an asset-based approach to social prescribing and the provision of information and advice. This project now employs 4 local asset coordinators, a triage officer, a development officer, and third sector community and wellbeing officer. And the project uses 5 ways to wellbeing to work with cohort groups, including over 50s at risk of becoming inactive, low-level mental health, lonely and isolated, and recently bereaved. The project works closely with GP surgeries, various departments, including social services, housing support, community mental health team, community resource teams, and other partners such as the North Wales Police and third sector organisations to take referrals through a social prescription platform. The local asset coordinators work on a one-to-one basis to set well-being goals with an individual that will help them to reconnect with their own communities and to remain healthier for longer, keeping people away from frontline services for longer. Well-being goals include attending activities that promote general health, such as walking groups, swimming, paddle boarding, green prescribing activities such as bushcraft, and activities that promote mental well-being, such as befriending groups, courses, men's sheds, and mother and baby groups. This project is a really great example of how we want to see a partnership-based approach to making best use of the resources we have available within our communities that will encourage individuals to think more about preventing long-term illness. And the project is overall monitored through data, and outcome information is gathered via the social prescribing platform. This allows them to capture a range of health and well-being data on individuals they support. And the platform also enables GPs to make referrals direct from their own notes on the screen whilst with the person, as well as having a self-refer option. And this means that for all partners, the cluster is able to keep track of the whole journey of an individual, regardless of who they've been referred by and where they have been referred to. It's just one great example of the many ways in which we are now developing truly integrated community-based interventions.
So thank you both to Lynn and Albert. Really key points there from our Deputy Minister, emphasising the importance of moving to a model of wellness, how this is everyone's business and that we need to join up and work together. And a great example from our Chief Social Care Officer for Wales.
Diolch yn fawr am y wahoddiad i siarad â chi y bore yma am ddirwedd rhag nodi cymdeithasol ledled Cymru. Thanks for the invitation to talk with you about the social prescribing landscape across Wales. I'm going to present our findings from the September 2021 report. But first of all, I have to do 2 things. First, remind us about the definition of social prescribing in Wales. And second, to introduce you to the WISPR, the Wales School for Social Prescribing Research. It's about connecting citizens to community support to better manage their health and well-being. Marcello Bertotti last week described 3 stages of social prescribing, and of course we have those: the referral stage, the consultation stage, and the community support or activity stage. And you can see them here in this linear diagram where we have the individual presenting themselves to a health professional or an alternative social care, housing or other professional, or indeed self-referring to a link worker or community connector, whichever terminology you're using. They then conduct a what matters conversation, co-produce an outcome-focused action plan, and then refer to the community activity or asset. For those of you who don't know about Whisper, we're a virtual school which was launched in April 2020. It is co-led by the University of South Wales and the Wales Council for Voluntary Action. We have 4 themes, a network of over 300 members, and we're linked to 3 communities of practice. We rely on our steering group and research students to contribute to our themes. Please come and visit our website or attend one of our many events and help throughout the year. So back to business. Our report, Understanding Social Prescribing Across Wales, was published in September 2021, and it provides us with the current context as we know it in Wales. This snapshot of social prescribing was achieved by using 3 methods. A mixed methods online survey of 61 questions, where we had 130 responses from 89 organisations. The focus groups, all 6 of them, with a total of 33 participants, comprising commissioners, practitioners, managers, and members of the public. And a workshop with a total of 30 participants of key stakeholders, divided into 3 breakout rooms to ask 6 key questions. Each method was analysed individually and then synthesised to identify key findings. And there are 4 key messages. We have a variation in provision of social prescribing across Wales, which provides us with both opportunities and challenges. Social prescribing is utilised, defined, and runs variably across Wales. Most social prescribers are based in the local authority and third sector organisations, with few based in primary care. Therefore, there are differences in underlying philosophy, approach, and delivery, which may need to be surfaced, addressed, and rebalanced. That is not to say that there has to be a centralised offer, that this variation may act as a rate limiting factor on the impact of social prescribing. Now you can see from the slide the 2 figures that we have there. On the left, the total social prescribing organisations that cover each local authority. Wrexham provides the highest number of social prescribing organisations, and Neath and Port Talbot provides the lowest number. But when we adjust for population, organisations per 100,000 of population, Merthyr has the most organisations, and Cardiff the least. And of course, we found that the majority of social prescribers are based in the third sector and local authority, others based in primary care, university, and other areas such as housing, community wellbeing hubs. This perceived variation could be exacerbated when seen in the context of confusion and lack of awareness within the public of what social prescribing can offer, and of course the varying terminology used. There is an opportunity here for sectors to work together and ensure a coherent, seamless social prescribing service which meets the needs of its local and national population. The second message is that social prescribing is a growth activity and expectations of it are high. Social prescribing is increasingly seen as a solution to a number of the challenges within communities across Wales. There is a commitment to expanding social prescribing capacity, and in some areas, the scope of the role that it plays. There is also a commitment to developing pathways that are focused on holistic approaches, which place people at the centre and are integrated with existing and statutory services across sectors. This is a real challenge to deliver upon, and there are issues to be duly considered so that social prescribing reaches its potential. One such issue pertains to the growing social prescribing workforce, their employment contracts, how the workforce is managed locally, and how social prescribing is coordinated nationally. The majority reported offering a holistic social prescribing model. The holistic model is the main type used, where the social prescriber provides a broad range of interventions. There are no limits to the number of times the person is seen. This is determined by the holistic assessment of the person's needs. The 3 main aspects of the link worker or community connector role are referral, signposting, relationship building, maximising the agency of the pathway user. Our third message is that technology is key to the future of social prescribing. So we need trustworthy digital directories and a way of communicating and collecting pathway activity and building our intelligence for evidence commissioning. Social prescribing at its heart is a relationship-centered form of support. It relies on the connection between individuals. COVID disrupted the emergent social prescribing models to such a degree that it is important that to recognise that remote forms of social prescribing will be important and a core feature of ongoing evolution and development for many years. And of course, there was much discussion, as you can see, about national level databases such as DEWIS, which were not generally well received. Finding ways that technology, whether in systems or in ways of making remote connections between individuals, work for people is central to social prescribing's growth. Using a digital directory and digital platform across pathways will ensure that social prescribing services are person-centered and produce data which helps social prescribing decision makers to be responsive to changes that are required in the future. Our fourth message is that we know that resources are fundamental to sustaining the whole social prescribing pathway right across the 3 stages, because it's pointless prescribing if the activity in the community just isn't there. Concerns were expressed throughout the study about the fundamental problem of the funding model and the challenges for sustainability that it brings. A variety of routes have been used to resource social prescribing services to date, but there are serious concerns that without guaranteed, or at the very least, much longer term funding settlements in place for both social prescribing services and the community assets, the promise of social prescribing could be undermined. If we first consider that the majority of social prescribers are on fixed term contracts, most commonly ranging between 6 and 12 months in duration, short-term funding impacts on stakeholders, training, recruitment, turnover of staff. In addition, there's often a burden on services and staff to identify and secure funding, taking away precious time from seeing people who need a social prescription. These concerns regarding sustainability extend to the whole pathway, and you can see on this slide an indication as to the variety of community assets used. We witnessed debate about the role of the social prescriber and community asset development. Some saw it as a fundamental part of the role, whilst others did not, but worked closely with others who developed the assets. However, everyone agreed that community assets are critical to the success of the social prescribing pathway. And to the 6 recommendations, there are no surprises. The planned national framework should be embedded across Wales, that local regional organisational structures and partnerships should consider the role of social prescribing champion to drive the regional social prescribing strategy and coordinate communication throughout the pathway. There should be a whole system approach to developing and delivering the social prescribing pathway, which is informed by intelligent commissioning. We should review the role and scope of the social prescriber, and we should evaluate the usability of the national single digital directories and digital platforms for Wales, such as DEWIS, Infoension, and products like Elemental. And we should reconsider the funding model used for social prescribing to promote a sustainable pathway for the future. Diolch yn fawr, and back over to you, Kerry.
Thank you, Carolyn, and apologies, I didn't get to introduce Professor Carolyn Wallace, who's the Professor for Community Health and Care Services with the Associate Director of Prime Centre Wales, as well as the Director at Wales School for Social Prescribing Research and a key partner in this developing framework. Really clear messages there from Carolyn in terms of those 6 recommendations, and really echoing some of those comments from Lynn and Albert in terms of further emphasising the requirement for a partnership-based approach, that we make the best use of our resources within communities and support them in terms of this model and ensuring sustainability of social prescribing across Wales. So very pleased now to introduce our next speaker, Dr. Karen Pardee, who will share a primary care experience of social prescribing. So bear with us, folks. We're just in the slide getting up, set moment. due to go live any second with Dr. Karen Pardy. This is where we need some music. I said about music earlier on. Perfect. Over to Dr. Karen Pardy, Community Director with Cardiff South Cluster.
Thank you, Kerry. Apologise, I have a little technical problem there. Thank you very much, and thank you for inviting me. What I'd like to do is just give you a very brief flavour of the social prescribing that we've been doing in Cardiff South West Cluster. And thank you very much for the Deputy Minister for mentioning in her address about some of the work we've been doing. So a real focus has been on social prescribing in our cluster since the clusters were first formed in their current form in around 2014. One of the first things that we did was look at establishing a garden project or a growing project. And this was a suggestion from one of our local authority colleagues who thought it would be a really good idea to have a focus on well-being within a GP surgery, which we thought was a fantastic idea. And we've been very much wanting to shift that focus away from a GP surgery being a place where you go just when you're ill to somewhere that's around wellness and about promoting health and well-being. And so we put together a partnership fund application together with one of our local charities, Grow Cardiff, and formed a community garden group, which is now based across 3 practices in our cluster. And we can refer patients directly, or citizens can self-refer themselves. And they come together in a group. It's not just about gardening, it's about reducing social isolation, coming together as a team, and obviously with focus on being outdoors and healthy eating. And the volunteers really come together and take ownership of that group. And they put on gardens at the RHS show in Cardiff, which you can see on the photos in the slide. And so the project is still going from strength to strength, which is fantastic. It's not all about gardening in our cluster, and we formed lots of links with the many fantastic community organisations who are within the Cardiff Southwest area. And we've just got so many different opportunities to support our patients and citizens in many different ways. It's also important that we've participated in research and evaluation, because obviously it's really important that we want to make this a sustainable for the future. So we've worked with partners such as Carolyn at the University of South Wales and Cardiff University to help to actually demonstrate the value of what we know is a good thing. And we've also had a focus particularly on diversity and health inequalities, which is particularly important in our cluster, which is an area of reasonably high deprivation. Another challenge that we faced is, as I said, there's a huge range of opportunities for social prescribing within our cluster. But as a GP, it can be really difficult just keeping track of what's around, what's available, and what would be best for our patients. So in 2018, we drew inspiration from the Compassionate Communities project in Frome in Somerset. And we've put in a bid to the Transformation Fund, which fortunately was successful. And we developed our own model based on that Compassionate Communities model, but very much focusing on what's available within Cardiff Southwest Cluster. And there are 4 main elements to our model. Community support is obviously at the centre, and we commissioned wellbeing connectors or social prescribers who are led by one of our community organisations, and they also run a community development service, because that's obviously really important to look at what's the gaps within our community. We have an integrated care hub where our cluster pharmacists, our occupational therapists, and our wellbeing connectors, social prescribers, work together, particularly to support people as they come out of hospital. And this has been very successful in avoiding readmission into hospital. We have a multidisciplinary team involving people from across the primary care health providers, social care providers, and very importantly, our third sector colleagues. We come together to help support people with complex needs. And advanced care planning, very important, particularly in our care homes, to support people to make informed decisions about their future care. And with our key outcomes have seen a reduction in hospital admissions in Cardiff Southwest cluster compared to the other clusters in the Cardiff and Vale area. This slide shows our multidisciplinary team. As you can see, this was pre-COVID when we had everybody in the room, and we've got all of those participants across health, social care, and the third sector. Since COVID, obviously, we've been meeting on Teams, but equally, we've got this really good relationship across all of those areas. We've sought feedback from our patients who we've referred through our social prescribing services, and we've had fantastic feedback. I think my favourite one is in the centre of this slide, where it says, "Thank you for your call. You have restored my faith in the National Health Service." Well, what more could we ask for? Our community-led wellbeing service comprises social prescribers and community development workers. And there's a huge range of opportunities now within our community. Obviously, with COVID, things changed very much. A lot more working remotely, but fantastic support for people in our community, befriending services, telephone services for those who are isolated and shielding, collecting prescriptions, food parcels, all sorts of support. And now that support is moving much more back into the face-to-face and looking at opportunities for to support our patients, but very much focusing on the preventative healthcare and looking at, for example, physical exercise and healthy eating. I think, as already mentioned by Carolyn, it's not always easy. There have been challenges, and I'd very much like to echo those that were raised by Carolyn. Information sharing and communicating is really important to get that right, and the information governance has been a challenge, and I would say is ongoing. Access to link workers, again, it's really important that we have that opportunity to have those link workers who will help to support our patients and have that what matters to you conversation. And also obviously support for the community. The evaluation, again, which Carolyn has mentioned, it's really important that we can demonstrate what we know is a good thing, but we need to have that really strong evidence base to support those funding opportunities going forward. Thank you very much, and back to you, Kerry.
Thank you, Karen. That was really, really great. A real example of partnership working and really understanding the opportunity this brings to support that community-driven approach in terms of prevention and well-being, and also address some of those health inequalities. So a really great overview there, and your work is inspiring to all. Thank you. So very pleased now to introduce our next speaker, Nicola Evans, who's Head of Health Inequalities and Healthy Communities with Welsh Government, who will outline the developing framework for social prescribing in Wales. Nicola, over to you.
Oh, thank you, Kerry, and I'm really pleased to be here today. It's really important that we get feedback from the primary care community in the development of the framework, because I know it's a fundamental piece of work moving forward for the sector. So hopefully my presentation is on the screen, and really just to sort of to start. With saying social prescribing isn't new. It's been around for a number of years now, and it's been of interest for on a policy level within Welsh Government for a number of years. And it's something that, say, from a public health perspective, which is the team I'm in, we see it as a way in which we can encourage people to become more physically active and to get out in the community and more health and mental well-being. From a primary care policy perspective, we see it as a way in which hopefully it can help reduce some of the burden on people within primary care. But also from other colleagues across Welsh Government, there's quite a lot of interest in it. So, for example, in sports and arts colleagues, they see it as a way in which it can encourage people to access the sports and arts community that they might not have done in other ways. And we've even had interest from colleagues in agriculture who see it as a way in which they could maybe diversify agriculture to looking at ways in which you can support well-being within farms, etc. So there's been a lot of interest in social prescribing for a number of years across Welsh Government, and that sort of crystallised itself into the Connected Community Strategy, which was our strategy for tackling loneliness and isolation. And we committed within that strategy to 4 national actions to try and embed social prescribing into the day-to-day work of the Welsh public sector. And as you can see in there was the 4 actions. The first of which was the baseline work that Caroline discussed earlier. But unfortunately, as with a lot of things, um, the strategy was published in February 2020, and then of course in March 2020, a lot of things was paused and a lot of resources were redirected, particularly, as you know, within public sector and within the sort of primary care sector to deal with the COVID response. And so some of those national actions were paused. However, interest in the area didn't go away, and certainly on the ground, the people working in social prescribing really stepped up to the mark in delivering for their local communities and supporting people who may be feeling isolated or lonely, and really supporting them at that period. So then, as part of the response to COVID and as part of the recovery plan, there was some consideration given to, well, what can social prescribing do in aiding that response? And it was a particular passion of our current health minister, Eluned Morgan, when she was Minister for Mental Health and Wellbeing. It was a particular passion of hers, and it was something that she looked to really try and understand what more could be done in this area. And then, unsurprisingly, it became a Labour Party manifesto and then a commitment within the programme for government to develop a national framework for social prescribing. And that commitment now has been taken on by Lynn Eagle, the Deputy Minister that you heard from earlier, about delivering this national framework. So in order to do that, a task and finish group has been established, chaired by the Deputy Minister. And the main purpose of that group is to, as I mentioned, understand how social prescribing could aid Wales in its recovery from COVID-19. And when we were setting the objectives of the group, the Deputy Minister gave us some really strong steers in terms of what she wanted that to look like. So she was really clear that the model should outline what best practice looked like in terms of a Welsh model of social prescribing, but not to dictate how it was delivered within communities. As you can see from the research that Caroline has done, there are a number of social prescribing services in a number of different sectors. So there's some within the GP clusters, there's some within third sector, there's some within local authority, for example. And she was really keen that we didn't prescribe it being delivered through a particular route, as is the case in England, where the majority of social prescribing is sort of funneled through the GP. So she was really strong, really clear in that aspect of it. And she also wanted the framework to guide and support the establishment of social prescribing and community connected services, where they didn't exist, but also to develop ones which did exist. As you saw from the research that Caroline had done, there's a mixed picture across Wales in terms of what is being offered and where it's being delivered. And so the intention is to use the framework to bring that up to a sort of a common standard across Wales. Um, there's also the intent through the framework to identify those areas where we can add value on a once for Wales basis. So what are the things that we can do across Wales once, rather than being done by a myriad of different organisations, and again, has come out strongly from the research. It's technology is one area, for example, where we might need to look at doing things on a once for Wales basis. And then the other aspect is about sharing best practice and networking, and so that the learning is shared across Wales. But really key for the Deputy Minister was she was really key that she really stressed the importance of co-producing the framework and the model in particular with people across Wales, so that it complements the work and adds value rather than duplicates what's already out there. So we do have as I said, a task and finish group, and we've got a host of members in that task and finish group, ranging from the National Academy of Social Prescribing, which is the lead body in England, and they've been really helpful in sharing some of their learning with us, to Well North Wales, which is a collaborative of social prescribers based in North Wales, Whisper, who have been really helpful in developing our evidence base and the research, the WCVA, the Primary Care Hub within PHW, but also other sort of stakeholders such as Natural Resources Wales, the Arts Council, the Sports Council, and HIW. So a whole host of stakeholders in that task and finish group. But it's safe to say that that task and finish group could have been 3 times the size, given the amount of stakeholders that we have. So what we've decided instead is to have a smaller task and finish group, and then do these wider engagement events with a whole host of stakeholders. And this is one of a number of events that we've got with a wide range of stakeholders, to take to them some of our initial thinking, our initial thoughts, to get immediate feedback before we go out to consultation. So we've had 2 or 3 meetings of the group so far, and at the last meeting of the group, the task and finish group signed off the first draft of the Welsh model for social prescribing in Wales, and this is something that has kindly been developed by Whisper and WCVA and others. And as you will see, it looks slightly different immediately to the model that Caroline presented to you earlier. The model that was originally sort of developed was a linear model, where you had somebody being referred into a service who was then referred out into an activity. And the feedback that we had from the task and finish group was that it was really important that whatever model was developed was person-centered, so that the person was at the heart of the service and what was being delivered. So that's why the focus now is on it being person-centered. The other big difference that you'll notice from the model that Caroline presented earlier is that instead of 3 referral pathways into social prescribing service, there are now 4. So there's a pathway from like clinical contact through a GP, a hospital, or other health professional. There's a pathway through contact with sort of statutory or third sector providers, and them identifying a need for this service. There's self-referral, and that is a growing area of referral into services. But the 4th area that has been identified is in relation to targeted social prescribing. population. So this is where where a particular cohort within a population are identified as needing some sort of support. And this was one that came through really strongly through our consultations with people like the Older People Commissioner and third sector organisations, where there might be a cohort of people who are identified as needing extra need, who then can be approached and told that actually there is this service available for you. And so that was the fourth referral route into it. The other big difference to the model is in the outer link, which is the social prescribing service itself. Whereas previously we've talked about a social prescriber or a link worker, and it's linked to an individual person, what feedback we've had so far is that it shouldn't be down to a individual or a person or a role, but more of a function. And that function may be delivered by a number of different organisations within a community. So it may be that one person might offer signposting services where that is appropriate. Another part of the system might offer a more bespoke peer mentoring service for particularly vulnerable groups, and another part of the system might offer community development. So we're not um, limiting it to one person or one aspect of it. So we're trying to identify a service rather than a person as part of the model. And then the outer ring is around the community assets that could be referred into. So it could be wellbeing support, it could be volunteer activity, it could be advice and assistance, it could be indoor, outdoor groups. It could be a whole host of things. And then it was important then to make sure there was some feedback loop into the service, the referral pathways, and back into the person in terms of the outputs. So this is the draft model that we're consulting on, and we've shared with quite a few people already. Some of the feedback that we've had is that it's still a bit, and we're conscious of, it's still a bit too busy. So there's still quite a bit of narrative in the model, and it probably needs to be powered back a bit more. We need to look at the arrows and make it more user friendly from sort of a public perspective, so that it doesn't need as much explaining when someone can look at it. So there's still quite a lot of design work that we need to do in terms of to really bring the model to life. But in terms of the concept of the approach, so this is the current model that we're looking for feedback and hoping to get some of your views from as part of today's process. As I think has been mentioned, there is an opportunity within the within Slido, I think, to do some immediate feedback, and I think there's a poll which will ask you your immediate reaction to whether you agree or disagree that this is the right model for Wales, and there's a number of questions there for you to have a look at. So I think that poll is going to be up for for the rest of the presentations and the day. So have a look at that, and that will be used as part of the feedback to us. And also, just as some immediate sort of feedback, I know this won't be your only chance for feedback, but just to get some immediate feedback is from your perspective, and try what we're going to try and do is create a bit of a word cloud with it, so that we can see the common themes that are coming through. What do you see as the main barriers to delivering this Welsh model of social prescribing in your area? So what are those things that if we were to deliver this model, if this was the model that we were in to embed, what are the barriers? And we've heard some of these already, but from your perspective, what do you think they are? And then also there will be another poll, I think. What support on a once for Wales basis is required? So what do we need to to support from a Welsh Government perspective, from a regional perspective, from a local perspective? What are those type of things that we can do on a once for Wales basis? So as I said, those polls are going to stay up, and we're going to have a look at those, and I'll be fed back at those after today, and it'll be really interesting to get some of your feedback from it. As I said, we've through the work that we've done already, we have started to tease out some of the issues that we think we will need to address to embed this model further. So I've put up on the screen there some 7 themes that have started to come through the consultation. So there's been a really strong theme in terms of workforce and about ensuring that the workforce has the skills and competencies needed in order to deliver this model. And we've been doing some work already with HIW on that and the Care Council of Wales on that to see how we might develop a core competency framework. There's been some discussion around monitoring and evaluation. You know, we heard from Karen about the importance of ensuring that we knew where things were working and how we monitored things and some of the barriers associated with that and how we might look to address some of that through some sort of core data or through information sharing protocols or that aspect of it. So, you know, that's another area that has been highlighted. Technology, absolutely key. We've heard about that already. And so is sustainability. As Caroline mentioned in her presentation around sustainability, not just of the service, but of the community assets themselves. There's been some discussion, particularly within the arts and the sports worlds, around the development of community assets and what makes them different to being a standard service. So the example I was given was, what's the difference between a singing for lung health group and a rock choir? Both of them will address loneliness and isolation, but maybe only one of them will help to specifically strengthen lungs through singing practice. And you know, who needs what specialist skills needs to be to run those classes, and you know, how do we know which one to refer people to? So there's some things that need unpicking around that. And do we need standards in community assets so that people such as yourselves are confident in referring people into these services, and that aspect of it. As I mentioned already, co-production is a really key theme, both for the Deputy Minister in terms of developing the model itself, but also in terms of developing the solutions at a regional level and making sure that whatever is developed is fit for purpose and doesn't inadvertently widen health inequalities. So how can we make sure that people are you know, really engaged in that? And then finally, there is some work that probably needs doing in terms of governance and leadership. This is a change to really embed this across Wales. This is quite a big change programme, and there will need to be really strong leadership at both clinical, political, and local level to really deliver the change. And to do that, there needs to be strong governance behind it, so that people are confident that you know, when things go wrong, that there are safeguarding and robust measures in place for when things go right as well, for when things go wrong as well as when things go right. Um, since we've pulled this together, another area has emerged in terms of referral pathways, and that's another thing. So, you know, part of the feedback today is really trying to understand what else we need to be thinking about in developing this work. So then finally, in terms of where we are in terms of timescales, so we're at the engagement event stage. We're talking to, as I said, you and a number of people on the framework that's been signed off, with a view then to take in a new model and the accompanying narrative that to support the model to the Task and Finish group at the end of April. That will then be published for formal consultation, and we will try and do some wider engagement work with the Welsh public sector at that point to get their feedback into what the model looks like, with a view to then do our responses over the summer and have the framework published in sort of September time. There is a standard email address that if you've got any comments after today's event that you would like to talk about or discuss, then please do. So thank you. And I'll pass you back now to Kerry. Thank you very much.
Thank you, Nicola. That was so informative, a huge amount of really helpful information and context to the activity that's in this space, really demonstrating the commitment and importance in terms of social prescribing and how we're trying to support that going forward. Really key messages there in terms of that Once for Wales approach and how we are looking to complement and add value and build on existing good practice, but with that flexibility of localised delivery. So a really key message there that's been threaded through. The person-centred model really sort of helpful in terms of that engagement and co-production to shape that model going forward around that person-centred, and the opportunity to target specific population groups who would really benefit from social prescribing. That was a key message for me that came through from that in terms of that anticipatory approach, preventative approach, and not reactive approach that this social prescribing brings us. It also really demonstrates there's a huge continuum of social prescribing provision. It's not just about specific workers, it's everyone's business, and how do we support that thread and that model throughout to support people of all levels of need and support and that assurance required with that. So really, really helpful there. And then in terms of the engagement opportunity that this brings to take in terms of those reflections in terms of what those barriers might be and what support's needed to overcome those. And the poll from Nicola's presentation, it's great that that's remaining open until I think it's about 11:25. So if you've not inputted yet, you still have time. So please do so. Right then, everyone, so moving us on to our Q&A session component of this event as an opportunity for you as an audience to raise questions using that Slido function. As I said before, if you haven't quite seen it, you just need to scroll down a little bit. So bringing back our speakers from before, so Professor Carolyn Wallace, Dr. Karen Pardee and Nicola Evans, but also would like to introduce a couple of other panelists, Dr. Sally Rees, Head of Evaluation and New Models of Care, Technology, Digital and Transformation Directorate with Welsh Government, and Dr. Amrita Jesurasa, Consultant in Public Health Medicine with the Primary Care Division, Public Health Wales, who's really been a key lead and support of this work, as everyone in the panel has. I can see we've got a first question posted and it's coming for Karen. A comment to start with, well done Karen. This is really inspirational. The next issue is how to spread this good work across other clusters in Wales. What are your top tips?
Thank you. Yeah, so top tips. I think my top tip is this has to be ground up. You can't just take one model and expect to just replicate it or impose it in another area. It's about talking to the people within those clusters across the whole sector. So healthcare, social care, and very importantly, community and third sector, and obviously the citizens as well. That co-production that was mentioned earlier as well. What are the assets that are there already? What are the communication tools that are there already? How do we actually make this work for our citizens within those clusters and develop a model which works within that cluster, but obviously, you know, looking at the framework within that framework that's been mentioned already, but I think it has to be driven by that community and very much building on the assets are there. The last thing you want to do is bring something in that is going to effectively push out what's already there. So I think those are my top tips. I think technology has been mentioned as well, and we do use a social prescribing platform, Elemental, which again has been mentioned earlier. And I think having a really effective digital communication tool, it's not everything, obviously, you know, we still need that personal connection, but having a really good digital platform is another key thing, I think. Thanks.
That's great. Thank you, Karen. And really helpful flag there with regards to technology. I know, you know, it's increasingly become part of our toolkit. And at the same time, as you've rightly pointed out, we're very mindful in terms of the restrictions it can also bring to some of our populations, and that sort of particular inverse care law applications, so and digital poverty. So really good flag there. Thank you. Going to take us to our next question, and this is for Amrita. So there's a flag here. There are a number. Oh no, sorry, wrong question. Here we go. How can social prescribing respond? Oh, perfect timing if I bring that in there. How can social prescribing respond to inverse care law principles? For instance, respond to access inequity, etc. And is there good alignment between primary care and public health agendas to support shared vision and approach to this? That's quite a question, Amrita. So if you want to chunk it in any way, and if we can support.
Thanks so much, Kerry. Well, yeah, it really is. I think taking the second part of that question, because that's probably the easiest bit, there absolutely is good alignment between primary care and public health agendas for supporting this vision. I think the chat has sort of demonstrated how much people recognise the value that social prescribing can bring within primary care, and I think in public health it absolutely is a key agenda for us to support the development of the national framework for social prescribing. And a key part of that is considerations around equity, both creating equitable approaches and trying to reduce inequalities is always a fundamental part of public health and key really to improving outcomes. I think in terms of how we can respond, that's much harder, but it's definitely something that we know that there are lots of ways we can address, and I think part of that is in the planning of social prescribing activities and responding to need, having the data to understand what a population's need is in different parts of the country and in clusters and in practices, and really understanding what that population's needs are and trying to ensure that there's that match up between the need and the activities and services provided. I think there are some other questions that are related to this that I've seen in the chat around accelerated cluster development and so on. And so I think there are definitely spaces for these agendas to come together with other agendas like the ACD agenda, and really thinking about planning at different levels and how that can have equity at the heart of it. Kerry, I don't know if anybody else wanted to respond, but that was the main points for myself.
Thank you, Amrita. Just to widen it out, if anyone else would like to come in. Certainly from my perspective, from the Strategic Programme for Primary Care and Accelerated Cluster Development, it really is how do we understand those needs of our local population. So from a cluster collaborative perspective, working together to understand and meet those needs, that informs that sort of pan-cluster locality that threads through to that regional perspective. So a really good link there. Karen, I saw your hand momentarily. Would you like to come and join?
Yes, I would like to. Yeah, I think around the sort of inverse care law, health inequalities, that's something where social prescribing is of such benefit, and we can really look at those needs within our population. In our own population in Cardiff Southwest Cluster, as I mentioned before, we've got areas of high deprivation. So at the moment, we're looking at supporting things like fuel poverty, also areas of ethnic diversity, and again looking at specifically tailored support within the community that we can help those more vulnerable members of our community with. So I think social prescribing is absolutely key to addressing those inequalities.
Thank you, Karen. Sally?
Thank you, Kerry. Just to sort of build on what Amrita has said and Karen in terms of social prescribing and reducing sort of health inequalities. I think what has come through for many of the social prescribing projects or services out there is they've been able to reach out to those who wouldn't necessarily have connected with any services previously, who've been, who've traditionally not actually even connected with statutory services, but have felt much more comfortable connecting with some local activity. that's provided with them with some kind of care and support or an activity that actually will meet their well-being needs. And I think that's been a real positive aspect of social prescribing previously, but certainly through COVID and most definitely in the future. Thanks, Kerry.
Thanks, Sally. That's really helpful. Thanks for coming in as well. Okay, Nicola, if I direct this next question to yourself, well, it seems there's been a number of questions coming through related to funding, as we anticipated, and there's something about what efforts are being made at strategic and national level to ensure sustainability.
So I think there's been work done already, I think, in this space in terms of recognising the need for more sustainable ways of funding services such as this. And at the moment, the majority, well, not the majority, but quite a lot of social prescribing services are funded through the Integrated Care Fund or the Transformation Fund, and the new fund which is being launched from April, which will be replacing those funds, is more of a 3 to 5 year fund. So there's that more continuity and consistency for people, so that you can have longer term contracts, you can have more sort of embed people within the actual service. So there is quite a bit of work that's gone into that already. That's not to say that there isn't more to be done. There is more to be done, and as part of the work that we will be hopefully taking forward as part of the framework, we'll be looking at that in more detail to understand what what do we mean by sustainability. How can we ensure that not only the social prescribing service itself, but the assets that people get referred into are sustainable. And it's at that sort of point it's worth reflecting that health and social care aren't the only funders in this space. So in terms of on the community asset side of it, there will be a host of other funders that we probably need to work with to make sure that if we are commissioning things, we can do it jointly so that we can be more so for example, some of the work we've done within Welsh Government around the Healthy and Active Fund, which is jointly funded between health and sports in terms of supporting community assets. We need to be looking at that model much stronger. And there might be funders outside of the statutory sector, such as the National Lottery and other areas, and we've brought them into some of our work so that there is an understanding of not just one funding source, but a whole host of funding sources. There's a much more of a mixed model of delivery of some of these services. So there's lots of work to be done in that space still, but it's definitely one that is on our radar and on, importantly, the health minister's radar as well, because I've heard her say in a number of meetings that she is still very keen that money is put into prevention services, which social prescribing can really support, even despite all of the work that's going on within responding to the COVID response. She absolutely is committed to making sure that prevention is not left behind while we deal with the COVID response as well. So I think there is a strong political commitment to this as well.
That's great, Nicola. Thank you. I think there were some really helpful messages there for people in terms of that whole system approach, because often, certainly when a whole system approach is thought of, it's potentially thought of in terms of health across settings and then health and social care. But actually what we're talking about, it's wider partners in that, across housing, across sports and leisure, across, all the areas. So how do we really harness that opportunity in terms of funding? How do we support that case in terms of demonstrable impact and value from social prescribing? So the opportunity that the developing social prescribing framework brings in that, in terms of demonstrating real outcomes because of that sort of once for Wales approach and that localised delivery, so that we can really demonstrate the value and impact in terms of our local population, that informs then and links through, as Amrita's already raised, that accelerated cluster development, that line of thread and sight between cluster, pan-cluster and locality through to regional partnership boards where the regional integrated fund sort of is administered and priorities recognised as part of that. So really helpful there. Thank you ever so much. We've got a comment that's come through that as chair, I'm going to take prerogative and take if that's okay, everyone. The comment is, as an occupational therapist, I would argue we are the original social prescribers, and our specialist skills and knowledge needs to be utilised to support training and the model development across Wales. It's essential we define the role and scope of social prescribers and that of specialist targeted therapeutic groups. So as an allied health profession, a professional, which is occupational therapy is one of those 13 allied health professions that I represent, there's no argument that occupational therapists are key partners in the social prescribing framework. That there's also a recognition that this is a huge space and there's more than enough for everyone. So how do we prudently and wisely use that skill set of occupational therapists in terms of that quality assurance and training and education in terms of social prescribing model, and how do we ensure that they are utilised and optimised in value in terms of those people with a complexity of need that need a targeted approach. And for those in the audience who aren't familiar with occupational therapists' sort of core functionality, it's about purposeful occupations, meaningful to the individual in their preferred place and environment, that's used as a means of assessment and as a means of therapeutic support and intervention to enable people to live and function well. So it's a great flag there in terms of the profession. It's not forgotten, they're a key partner, and we would welcome the support, but I would just reinforce that it's a big continuum in terms of social prescribing, and it's a space for all of us, and it's everyone's business as well. Karen, I'm very happy to bring you in on this as well.
Thank you. Yeah, so I wanted to sort of echo the support for occupational therapists within primary care. We have one based in our integrated care hub and also sitting within our multidisciplinary team, and you know, an invaluable contribution. And I think I just wanted to flag the importance of that MDT working, including social prescribing and the people that are involved in that, because in our MDT meetings, people inevitably, they do have quite complex needs, and we talk together about where that person would best, you know, be directed to, and there is inevitably quite a lot of overlap between different services, and it's that working together which I think is so important to make sure we're using people's skills to the best advantage, and obviously in the most prudent way as well. So just a big shout out for MDT.
That's great, Karen. I think, and just to build on that as well, I noticed there was a comment in terms of NHS, and sometimes, you know, we can professionalise things and we can use disciplines and professions, but this is really about a collaborative approach together and how we harness the skill set that we all bring in terms of delivering this framework and the opportunity that brings as well. So many thanks for that flag from the audience, and a great response there, Karen, as well. Thank you. Like to direct the next question to two of our panel members, if I may. First one I'm going to bring in is Carolyn, and then I'll, Sally, if I can bring you in as well. There's a question here saying there's a number of good practice and services in place. Bringing the third sector providers together instead of working in silo has been a huge issue due to some competing demands around funding, etc. Any ideas how to get them together in a productive forum?
Well, this isn't an easy question, and it has got a complicated answer. There are a number of issues with regards to this question to address. The first one is about, yes, there are a number of good practice and services in place. However, we have massive gaps in evidence in order to support that statement. And the second one about bringing the third sector providers together instead of working in silos. And there are good evidence for how professionals and organisations and sectors come together under the umbrella of social prescribing. And, we've got the example of the role of the community of practice within social prescribing, which we connect to from Whisper. We have need for interprofessional training and education. But one of the issues we've got is the fact that actually the third sector role isn't as well represented within the published literature, and so it's not as well appreciated as all other sectors. And that's from an academic perspective. When you look at the literature, the third sector is not very visible there, and that's because the literature has been very much focused upon primary care in the past. But we're hopefully helping to sort that out by developing that evidence in Wales, because it's been, because we've been growing social prescribing from the grassroots, and social prescribing is very dominant in the third sector. So if we are to work together and we are to come out of silos, then it's about recognising each other's roles and where we come from. It's about appreciating what we do and what each of us do separately and together. And it's about bringing those values and those skills, etc., together into several common spaces. And of course, one of the recommendations in the report was for a regional champion to be able to help to do that. And so I think, recognising and adopting that type of a role would be really valuable from a regional and national perspective, if we were to do so, and would help us to actually have more equality across the social prescribing team.
Thank you, Carolyn. Sally, if I can bring you in as well.
I mean, Carolyn's right in terms of the evidence. It's very much focused on primary care within the social prescribing space. However, we already know in Wales, and we've known for some time, that social prescribing actually developed from the ground upwards, from, the work that was happening in the voluntary sector. I think in terms of this issue around voluntary third sector organisation, community organisations working in silos, I think there is, I recognise that, coming from the third sector previously in my role at Wales Council of Voluntary Action, and a lot of that has been down to this competitive market in terms of funding, everybody chasing the same pots or the similar pots, which has made it really difficult in terms of bringing people together to work in partnership. I think there is a key body, I think, that can help with that. And we're fortunate in Wales that we've got voluntary councils, local voluntary councils that are operating in every local authority area, who could be the drivers to bring organisations working in that sort of social prescribing place together. Many of them already do, and they're actively got social prescribing or community connector services themselves, like Powys, for example, and other local authority areas. And I think WCVA has probably got a role in coordinating all that, which I was doing, I suppose, previously in my WCVA role. So I think from a primary care perspective, it's connecting with those local voluntary councils to have conversations as well, not only around trying to bring some of that sort of social prescribing activity together and for them to be working together, but also to actually find out what's going on out there to avoid duplication. So if you're looking to do, something similar to Karen, and as she said, you can't just lift and shift, because there'll be different types of activities and different people involved. But there are there's some core components of social prescribing that are appropriate wherever you live. But for me, I think it's about making sure that you already know what's out there before you decide to design something yourself.
That's hugely helpful as well, Sally. Thank you both for that. Really clear messages there, and we have, in the past had this competition for resource that hasn't been helpful, and people coming forward with new or developing ideas when we haven't really learnt from existing or scoped what the existing offer is. So really how we do work in partnership and collaboratively together will be really key going forward. So many thanks for your responses there. We've got another question that's come through that I'm going to direct to two of the panel members, to Amrita, followed by Nicola. So just to give you the heads up. This one is with regards to transport. Transport for people to use social prescribing opportunities is a significant challenge in rural communities. Public transport is very limited, if at all available. Volunteer opportunities have been reduced due to COVID concerns and the cost of fuel, adding to the challenge. We need to consider all barriers. Amrita, if I bring you in first.
Thanks, Kerry. I think in some ways this relates to the earlier question about the inverse care law principle. When we think about equity, we've got the aspects around deprivation, but we know that there are so many other forms of inequality that can happen related to age, ethnicity, geography, and rurality is a really key issue within that. In Wales, we know that we have many populations who have who live in very rural areas, and transport is a really key issue. I think that there's been some great learning though from the pandemic about how we can support people better, thinking about the digital options as well, but whilst recognising that digital inclusion is a really key aspect to consider within that. Again, there aren't always easy solutions, but I suppose it's trying to build on where there has been effective evidence, and at its heart, as many people have mentioned in the chat, social prescribing is really about that connection to the community. So I think it is about making it as close to home as possible for people in terms of those opportunities and trying to reduce any barriers to access. Thanks, Kerry.
Thank you, Amrita. Nicola?
Sorry. Just really acknowledging that it is an issue, and that it really can be a barrier to accessing services. Certainly, it was recognised in the Connected Community Strategy, which is our strategy for loneliness as and isolation, as being a real barrier for people. But as Amrita said, there are lessons that we can learn from the pandemic, and how in some ways the move to online has really expanded the access to services for a lot of people, and we need to sort of hold on to the positives from that, so that we continue with that approach as we move out of the pandemic, and move that forward. But as Amrita said, there's no short-term solutions for this. It will be a longer-term fix in terms of bringing communities together. And I think it just highlights again, Kerry, the importance of that sort of holistic approach across the whole system. It's not just about one individual organisation or one individual aspect of a local authority. Even we need to engage with partners right across the board to make sure that what is being offered works for the community to which it serves, I think.
That's really helpful, Nicola. Just to share with everyone, I live in West Wales. I live in a really rural location. I'm about half a mile from a bus stop that operates once a day, 9 o'clock and 3:30. And I have no mobile phone connection unless I have it through Wi-Fi, and I only get Wi-Fi through satellite. And positively, I know from a sort of a whole system Welsh Government approach, we have been targeted in terms of area, in terms of that connectivity, recognising the importance of how that infrastructure will support, that wider health and wellbeing and connectiveness that will then inform, the ability to support social prescribing and wider activities. So it's how we thread all of that together. So that's a great flag there, Nicola, as well. Okay, so I'm going to bring us to our last question, which I'm going to open up to panel members in terms of opportunity to respond. It's how do we ensure genuine collaboration and co-production between health, local authority and third sector for the benefits of community members? Understanding a few might like to contribute to this today in terms of that response. So how do we ensure genuine collaboration and co-production between health, local authority and third sector for the benefit of community members? Rita, many thanks if I bring you in first.
Thanks, Kerry. Again, like a lot of things, I think in terms of the challenges with social prescribing, collaboration across sectors is a really key one. I think it's great that in Wales we have an aspiration and ambition that that's the model for social prescribing, that it's cross-sectoral and that it's recognising that this needs to link across all of the sectors, because that's a different model to other parts of the UK and elsewhere. So I think that the ambition in itself is feels like the right one. But I think in terms of how we do that, I think this is really where the national framework has that potential to support this, because obviously that wasn't there before, and it's already provided a lot of momentum to bringing us together. Bringing those of us that are on this panel together, as well as lots of other key partners who we've been talking to and working with. I think that the complexity of it means that sometimes the timescales of seeing the outputs of that collaborative effort and that then kind of reaching the kind of frontline ground level work as being an apparent collaboration, it may take more time, but I think there is a lot of scope and potential there, and I think to some extent that is underway already, hopefully.
Thank you, Amrita. And I could see nodding heads from Sally. Carolyn, you popped your hand up, but I'm wondering, do you still?
Yes, yeah. That I think for me it's the old thing that through any form of integration process. And that's what we're doing here by working together, collaborating together, coordinating together. That it's putting that person, the people first in whatever we consider. And if we have that people-centered focus, then genuine collaboration and co-production will happen. But it also means that, in doing that, we all see it's going back to seeing ourselves as equal voices around the table, and that in around that table, the members of the public are there as well. And so for me, as I said, it's about being people focused.
Really important point there, Carolyn, really helpful in terms of that person-centered, how that drives that collaboration together and ensuring that sort of engagement. Karen, if I bring you in.
Yes, obviously echoing Carolyn's words there about being person-centered, and I think there has to be a focus and focusing on what's the needs of the people that we are looking to support. But also time is the other key factor, time to come together from our various different backgrounds, get to know each other, get to understand how different organisations work. And I know from my perspective, that was a huge learning curve, just seeing how different sectors, health, social care and third sector, have very different approaches and different ways of working, and how we all learn from each other and get to know each other and get used to the different ways people work. So so time is a really important factor as well.
Perfect, thank you, Karen. And I thought you were upset, Nicola, but Sally, if I bring you in.
Thank you. I think it's just really building on ensuring that people, citizens, patients, carers, whatever you call them in your field, are really set at centre stage in terms of how social prescribing develops now and in the future, and be part of the whole design process, including the framework. I mean, the drivers are out there in terms of co-production. It's instilled in the Social Service and Wellbeing Act as a core principle. It runs through A Healthier Wales. and including the importance of people having voice and control over their lives. And I think social prescribing has a role to play in ensuring their voices are heard in terms of what kinds of support is going to meet their needs now and in the future. And where we've seen social prescribing and other services really work well is where they've really spoken and involved individuals right at the very beginning, and including, you know, frontline workers, and not forgetting they have a role to play in terms of what services and support will meet the needs of those that they're already working with.
That's great. Thank you, Sally. And Nicola, final comment?
Yeah, so I think just to say really the hope behind the development of the social prescribing framework in one way is for it to be really clear to all of the different partners where they sit in the whole, so that people understand their roles and responsibilities within this space and what their role is in delivering this model. And that should, by understanding that, hopefully then that will lead to working together to deliver it rather than competing to deliver it. So if you know what your role is and you know what you're there to deliver, then it will hopefully lead to a more collaborative model, rather than when that you might, as been referenced previously, where people are competing for similar sort of pieces of work or similar funding or that aspect of it. So that's the hope behind it anyway. So hopefully by working together we can achieve some of that.
That's great, Nicola. And I'd link that comment we had in terms of occupational therapy with that. For those colleagues in the audience today who are occupational therapists and wider, you know, you have a key part in supporting this, and we would really welcome your contribution to really driving the model forward as a key partner. So many thanks. Just a quick reference to the poll. I'm mindful of time, so just before we close, some really key themes coming through, really helpful, and sustainable funding, as we sort of perhaps anticipated, is coming through loud and clear. So many thanks to that, and many thanks to everyone for joining the session today and your engagement, and many thanks to all of our speakers who've been extremely informative and supportive in terms of the development of this framework and really helpful information and sharing today in terms of the way forward. So thanks. In terms of next steps, feedback from the event will be collated and fed into the framework development prior to its publication for consultation, as Nicola outlined earlier on, and the Primary Care Development and Innovation Hub. We are posting a feedback form in the Slido section below and would really appreciate your thoughts on the event today. It's also an opportunity to share anything you haven't had the opportunity to this morning. And we recognise we've had a large number of questions and comments which we haven't had time to answer. So we will feed these directly into the development of the framework and work to support primary care to engage with social prescribing going forward. So hope the rest of your day is kind to you, and many thanks again. Diolch yn fawr. Goodbye, everyone.